As a nurse, my professional identity starts and ends with one core value: patient care. This is maximized through three things: leadership, communication, and evidence based practice. Leadership is shown and developed through acting honestly, not being hesitant, being able to learn and be taught, and taking care of my own body physically and mentally. Communication skills are important for good nurse physician communication, being able to express my opinion without fear of judgment, and being able to step up and communicate an individual's role in certain situations. Evidence-based practice is a way to assess the situation of a patient and act on it accordingly. These three things focus all on patient care and show my professional identity. My professional nursing role, rather than patient care, can enable interprofessional practice and optimal outcomes through the patient from various angles. Being able to identify hazards like hand washing, allergies of the patient, and proper medications can mean life or death. If hazards are identified and taken care of, though, desired patient outcome is probable and safety is ensured. Being culturally aware by not stereotyping, using proper communication techniques, and providing the same compassion and coordinated care for each patient is equally important. To protect the optimal outcome of the patient, I need to be sure to follow HIPAA regulations carefully and keep patient privacy secure. All these things ensure quality care for my patients. My professional role as a nurse can enable interprofessional practice and optimal outcomes for the staff by knowing and following safety initiatives like TCAB, Transforming Care at Bedside, and the Joint Commission's annual safety goals. Also, being able to help fellow employee with patient care when needed will enable practice and give optimal outcomes for the staff and patients. For organization to enable interprofessional practice and optimal outcomes, there are two categories to look at. The first being the organization of myself, practicing stress management through mindfulness, exercise, or practicing deep breathing, good ways to prevent physical symptoms like hypertension and mental symptoms like drug addictions from occurring. The second is organizing the workplace, keeping patient privacy, making sure to log in and out of EHRs, and keeping track of paperwork are all ways to stay organized and maximize optimal outcomes in appropriate interprofessional practice. Professional communication between fellow employees, including doctors and other nurses, should be open and cooperative. I have to make sure that I am not intimidated to call the doctor when patient's health is jeopardized. I also plan to prevent and resolve any conflict within the workplace as quickly as possible so that my employees and fellow employees and I can continue focusing on patient care. Professional communication, although starting with fellow employees, is not limited to an employee-employee basis. It also extends to the patient. I plan on focusing on applied quality improvement for the patient by protecting, being culturally sensitive by remembering Purnell's 12 domains of culture, being empathetic, and identifying what appropriate slang and language should be used. I will also work around language barriers by using a translator or a responsible adult in the family that understands the health concerns of the patient. For both fellow employee and patient communication, I must practice making observations and be able to question statements made by others. My language should be assertive by not being too aggressive, but not being passive either. I must also be patient and, above all, be an active listener so I can completely understand someone's point of view to the best of my ability. This is a great way to prevent tension, and I must be able to not take anything said to me personally and use I sentences to prevent unintentional blaming. Communication skills I learned in 253 will be integrated in my future practice by treating each patient equally and with the best possible care, regardless of all factors. I will manage communication between fellow health workers through the 5 modes of conflict management. Using these will prevent argumentation and increase the level of understanding and better teamwork between workers. I will also use the idea of evidence-based practice to bring confidence to my future practice by giving me the encouragement to speak up for the patient based on what I can observe and what I know. This may encourage dialectic argumentation, but will also bring out education to all the medical staff involved. What I have learned in 253 is vital to optimal patient care. I know the basics on how to effectively communicate between fellow employees and doctors, have proper organization and leadership skills in the workplace, and am able to use evidence-based practice. These skills all point to one main goal, and that is to always put the patient's health first.